I'm Mickey. Take it or leave it.
Hi, Mickey.
So this part of Safety Stand Down Week is the rehab and the focus on rehab. It's nothing new, but it's something that we can learn from and learn to get better at and take care of ourselves. One of the days in there is mental health, so that's why I'm here. I'm not, don't do as I do as I say, maybe. So we're going to talk about some traumatic stress and some issues with it, kind of give a little overview, and then we're going to talk about ways that we can get through it or keep our department at a minimum. The bottom line is we got to help people, and if we're not at our best, we're not going to give them our best if we can't give it if something else is going on with us. If we prepare and plan and educate ourselves, we'll be able to provide a better service. In your traumatic stress objectives, we're going to learn the proper definition of stress. We're going to know the different types and understand the physiological and psychological effects of it. So stress, the term stress, that's a state of mental or emotional strain or tension. That's what's happening, that's stress. A stressor is the outside force. That is something that causes a state of strain or tension. Think about trauma. On a trauma, it's an outside force, right? A stressor is an outside force. A stress response is your physiologic reaction that occurs in response to a perceived harmful event or threat. So this is what your body does when it comes into contact with a stressor. What happens? So example, the tones drop, that's a stressor. That's our stressor, we have to take call. The stress response is an increased adrenaline and anxiety, okay? Target organs, your heart, you have an increased heart rate, high blood pressure, your respirations pick up, so it involves your lungs, things like that. So that's kind of how that works. It starts a snowball effect, and that's every stressor that you come in contact with, whether it doesn't have to be a bad car wreck. That's all stressors in general. So when we talk about stress, there's different stress. There's good stress and bad stress. Eustress is a positive stress, relieves negative stress. Think about riding a roller coaster or going on vacation. It's something you get excited about. It makes you feel good. That's eustress. A distress is a negative stress. That's the stress we commonly think of when we say I'm under stress or there's stress. It is negative stress and it will erode your health. We talked about the high blood pressure, issues with strokes and firefighters. It causes anxiety, it can cause depression. It kind of erodes your system a little bit. So what we're going to talk about is the types of stress that are negative. You've got your cumulative stress known as burnout. We've always, you've heard the term, oh, so-and-so's burnout. They've run a lot of calls, they just don't have it anymore. That's slowly chipping away at your system and eroding your system, so they don't have the ability to respond as they should. So that's called burnout. It's what we refer to as burnout. A traumatic stress or trauma stress is due to a perceived threat. That's basically a one-time incident. A traumatic stress is, okay, we went on this bad call, or I went through a divorce. That's a traumatic stress. That's kind of a one-time deal. That's not a bunch of little ones piling up on you. That's just one incident, if that makes sense. So we're going to talk about traumatic stress, which is the stress you receive from a traumatic event. And it doesn't have to be, when we talk about these things, trauma, traumatic event, that doesn't mean I went on a bad call, went on this, went on that. That anywhere in your life, that could be a traumatic event. Whereas, your kid gets sick and it affects you, or you have financial troubles or something. It could be anything. And, we've always heard the term different strokes for different folks. If me and Cody are introduced to the same stressor, I may not be able to cope with it, and he might. That's just your different upbringings, the things you've come into contact in your life to prepare you for where you're at. So different things will affect people differently. That's why some people are able to get through certain stresses where it hangs others up. So traumatic stress occurs when the stressor is present in the moment. That's traumatic stress. You're in that moment right now, coming in contact with that stressor. That's your traumatic stress. And your body's response to that stressor overwhelms your ability to cope. So that's your traumatic stress. Post-traumatic stress is a disorder in which a person has difficulty recovering after experiencing or witnessing a terrifying event. Now, your body naturally, your mind will naturally begin to try to heal itself, just like if you get cut. After the incident, that's post-traumatic stress. Your body's attempting to heal. It's going to take some time. When you get to post-traumatic stress disorder, and we use this term way too loose. I got PTSD for this. I got PTSD. Well, PTSD get flared up. We use that term way too often. That is an actual diagnosis from a physician or a healthcare professional that you would go see. You have to have certain things in place for that to be diagnosed. And one of the big ones is duration of signs and symptoms for at least a month after that incident. Dysfunction or disruption in normal life pursuits. You're not able to maintain what you were doing before. Your habits have changed. You become distant, reclusive, things like that. So we use this way too often. We see this a lot. So traumatic stress, how we cope with traumatic stress, it's similar to the grieving process, where we have denial, anger, bargaining, depression, acceptance. It's like a hill you go up and then you come back down, you're good. So what we talk about when we say getting stuck, your body or your mind sometimes has things in it that don't let you process it appropriately. So what you'll do is, and it's going to keep trying, your body, it will keep going. If I go through denial, anger, and bargaining, and I get stuck at bargaining, I can't get past bargaining in my head, what your body will do is hit reset, and you will start back at denial. And you'll start that process again, and then you'll get stuck here again, and back here. So it's a vicious cycle that you go through. You'll see these people that have issues, they're going to tell you, ask them, does it make you mad? Is it, yeah. And then they get kicked back and they start getting mad again. If you've ever been through anything like this, personally, where you've had to get some help, and I have, that's like, oh my gosh, that's it. Couldn't get through it. So we got to figure out how to get unstuck, and that's where the mental health professionals come in. They'll figure out where that stuck spot is, and they'll get you through it, and your body will process naturally. Triggers, those are things that kick off your traumatic stress. Those are things that will bring you back to the moment, if you will. For instance, if you go to a car wreck at an intersection and it became post-traumatic stress for you, you're going to avoid that car wreck or that intersection, because when you go to that, you're going to see that, and it's going to flood you with those emotions that you felt that day. It's going to set you right back in that place and time, and you're going to start experiencing those emotions again. So there's triggers. You'll notice avoidance of triggers. That's a big one. Your trauma membrane, that's basically your mind's ability to help you live. A positive trauma membrane. I went on vacation. I had a blast. I was introduced to all new stressors, positive stressors. That's the eustress we talk about. I want to go back. So your body tells you, that was fun, I want to do that again. Negative trauma membrane. If I grab one of those cast iron skillets that's been on the stove for a while, I'm going to burn my hand. When I set it down, I'm not going to go touch it again, because it's entered into my negative trauma membrane. Every time I go touch a pan, I'm like, ooh, let me check it see if it's hot first. That's your negative trauma membrane. And what that is that keys your trigger avoidance. That trigger for me was grabbing that hot pan. That trigger for you might be an intersection, a sound, a smell, anything that will send you back to a moment of a stressful event for you. So we talk about traumatic stress. All this stuff started. They started understanding it in the Civil War. It's called the soldier's heart. So we've got other terms for that. Shell shock, combat fatigue, PTSD, Why is traumatic stress a new topic in the fire service? The personality. You gotta be a little different to wanna be in this business. Most of us are type A personalities. We don't like to show weakness. We're kinda alpha. We're not gonna show or let on that something's bothering us or hurting us or worried. Tradition, that's the same reason our fire trucks are red and not that ugly greenish yellow color. Those are better. They would be seen more, but we like tradition here. The old guys that passed it on to us, we don't talk about stuff. They never talked about it, but we gotta break that tradition. And knowledge, we didn't know a lot because nobody had ever tracked it within the fire service. Now, all those terms I gave you, that's military terms because they started tracking it. We don't really track it, and we're starting to now. So, IAFF did a study that was it was a direct job connected stress study. They studied 7,000 firefighters. And at some point in time in their career, 19% of them had thoughts of suicide, 27% had substance abuse, 59% had family and relationship problems that were due to the on-the-job stressor. So 65% have had not just memories, but haunting memories or bad memories of bad calls. So the last two are over 50%, it's over half. In 2018, firefighter suicide exceeded line of duty deaths in the United States.
Yeah.
So there is a problem. We know there's a problem. We're trying to get educated on the problem. But now we gotta figure out what we can do.
They are on their way there. He said he's like probably about 6 minutes down. He's gonna be in a black pocket Ford. He has a 36-year-old female that he believes is having some kind of allergic reaction. She is alert and breathing. It's gonna be 33 hours.
So these are some of the things we put into place or do about critical incident. Your informal things and this is stuff that we do. We have a peer support team. We're able to go to first responder support services. That's a great thing for this department. Other departments can as well if they can develop their own or choose a different program. More formal things are diffusing and CISD. If you guys don't remember, diffusing is like within the first 8 hours with your crew. We'll talk more about that here in just a second, but CISD, that's the more 24 to 72 hours. That's the formal incident debriefing, the critical incident stress debriefing. That's the one that in the past we've always not liked because it puts pressure on us. But the diffusing, that happens here within the first 8 hours. That's a big one. So again, we come back to the team, what can we do? So we have a peer support team in place, just like we talked about right there. And those people you can call if you notice something different, something changing about someone, and we'll talk with them and kind of evaluate them. We're gonna find out, okay, are they processing things appropriately to get through that grievance process that we talked about? Are they gonna be able to pass through, or are they gonna get stuck and they're gonna go back to the first? What are they gonna do? If we know that they're gonna get through it, we're gonna let them go. We talk to them, get them through it. If we know that they're gonna start back at the first, if they get stuck somewhere and they go back to the first, we're gonna relay them on to first responder support services so that they can get the information and treatments they need to get through that situation. There's a list that we have of peer support people. And I'll tell you right now, as far as mental health, this department, it's awesome. If you don't want to talk to me, you can talk to somebody else on the team, somebody you feel comfortable with. But one of our roles, as far as peer support members, I may not talk directly to that person. If somebody says, hey, so-and-so's having a problem, and I know so-and-so doesn't want to talk to me or doesn't feel comfortable talking, I'm gonna reach out to that person's crew or somebody that knows them well. Hey, how's so-and-so doing? What's going on? Or how do you think they're doing? And we can kind of run around the edges to figure out what's actually going on and if you're processing appropriately. And as far as being a formal peer support member, everybody does peer support. That's what it's called, peer support. You might have a formal member, but we all do it. And we've all talked about kitchen table talks. That's what we do at the table. We talk about things, and we all do peer support on a daily basis, if that makes sense. So we have to keep doing that. And that's actually, I think, one of the reasons we're on the increase of mental health issues in the fire service is because we have a lot less kitchen table time. That doesn't mean we're busier or the advent of technology has come up, so we're now on our phones or away. Used to, that's all you had, so that's what you did. And now things are changing. So one of the things we can do in our department is slow down with the phones, slow down with the iPads, and just talk. Get to know each other better. And when you do that, you'll be able to tell people's emotion within just a few minutes of the day. For example, when I walk in, I can say hi to Cody and he can say hi back, and I can usually tell by the way he says hi what kind of mood he's in. I can tell if so-and-so is rocking the chair a lot faster than they normally do, that something's on their mind. I can tell if you're shaking, if you're nervous, if you're drinking more coffee than normal. There's little things that you can tell. And we live with each other here for 24 hours. You can pick those details up. Everybody can. Everybody that's on the same crew knows each other. After an incident, whether it be on the job or off, it's very important that you follow through with your routines. Don't change your routines. That will help you pass through that spot. So if your routine's to work out and go fishing twice a week, work out 3 times a week, continue that routine. If you're supposed to pick your child up from school, go pick your child up from school. You gotta stay on your routine. Don't slow down, stay on your routine. And that will help get you back quicker. Our goal in this is to be more resilient. And what that is the ability to withstand and recover quickly from traumatic or difficult situations. Okay, if we learn to get through it, then it's not going to affect us as bad. We can be better for everybody else. We're not stuck, or we're not going halfway. It's 50%. We're not showing up to work at 70%. We're 100% able to help people. So we have that's not anything to do with it. One of the things for this week that I would like for everyone to try is take 15 minutes sometime, whether you're at the kitchen table, you're in the training room somewhere, set your timer on your phone and set your phone down. Get a partner and you talk nonstop for 15 minutes. If your partner doesn't talk, you talk. 15 minutes uninterrupted with your phone down. Just start talking. You think it's really hard, and it is for about the first 5 minutes. And then that alarm goes off at the 15-minute mark. You go, I'm not done talking, I have to finish this. So that's gonna teach us to be our communication skills. It's brain pain. Pants are too tight, it's good home circulation. So for this week, the 15-minute challenge for your mental health. Find somebody, set a timer for 15 minutes, and you talk. They don't talk to you, you talk to them. They remain silent, you look at them and you talk to them. You won't have a problem.